Welcome to Unit 2, District Health Management and Planning. Session 2, Planning for Health. Preparation for planning is the first step towards the development of the plan. Planning itself requires considerable time and resources. It should therefore be planned and budgeted for and funds made available. The planning team is expected to set aside adequate time for preparation, which may take 2 weeks as proven by some experiences. The important preparatory activities to be considered for an effective planning are determining when planning has to be carried out, identifying persons to perform this important work of planning, determining the budgetary requirements for planning and comparing same with available funds in the current annual work plan, establishing a time frame for planning, assigning specific tasks and responsibilities to each member of the planning team, and developing a methodology for evaluating the planning process and output. Securing funds for the planning activity and arranging for logistics, such as inform the team members of the planning session, request permission from their supervisors, arrange for transport, and arrange for stationery and equipment. Collecting documents for review, including an updated district health profile. Health planning at district level. The health sector reform policy recognizes that the district is the most important operational level for the implementing of the primary health care strategy. Financial and managerial responsibilities will therefore be decentralized to the district level. Effective district health planning depends on a number of conditions such as planning skills, planning structure, planning processes, planning culture, and planning horizons at the district level. District Health Management Team. The role of the district management team is to mix and allocate the available resources in the best possible way to meet the basic health needs of the community they serve. The district health office is usually managed by a team of health workers called the district health management team. A typical district health management team consists of the district health officer, public health nurse, hospital administrator, nutritionist, and environmental health officer. In Rwanda, the district health management team meets on a quarterly basis, and the proposed membership include vice mayor in charge of social affairs, district director of health, hospital director, district health planning and coordination officer, district health monitoring and M&E officer, health promotion and prevention officer, director of pharmacy, director of Mutual, representative of heads of health centers, representative of community health workers. Imihigo in health planning. Imihigo was designed as a Rwandan approach to performance management, as described in a policy note published by the Minister of Local Government in 2006. The Imihigo approach shares many characteristics with result-based management tools. First, each Imihigo identifies a set of clear priorities. Second, each Imihigo presents a set of specific targets backed by measurable performance indicators. Third, each Imihigo undergoes a well-defined process of performance monitoring and evaluation. Fourth, each Imihigo constitutes an efficient accountability mechanism and an incentive for local government leaders and their population to implement the decentralization policies and to meet local and national development targets. District planning is an integral part of operational district health management. It involves a number of processes such as situational analysis, programming, implementation, monitoring, evaluation, and reprogramming. The planning cycle for health performance. The planning cycle is a sequence of steps which must be followed in deciding what to be included in the plan. The cycle seeks to answer questions such as, where are we now? Where do we want to go? How will we get there? How will we know when we get there? There are 8 points to consider for health performance. 1. Use of local district data, community information, local research information and data, essential services, delegation of planning and implementation, community partners, cost effectiveness, and accountability.